Hey there again, it's me, Dr. Josh, and we are talking about how to grow your practice by raising the level of trust, growing the trust that your patients have with you so that they undergo and complete the care that you assign them, aka they get better results, and they refer their friends, and you have that massive impact on your community. Isn't that why we all got into healthcare? So today I want to share a study with you. It's called Exploring and Validating Patient Concerns, the Relation to Prescribing for Depression. Now, this one's from the Annals of Family Medicine in 2007. The authors are Epstein, Shields, Franks, et al. And they did a kind of interesting study here. What they did is they had actors or standardized patients going to a clinic and complain of low back pain. The goal was, through the questions that the physician asked, they wanted to also reveal that they were suffering from depression and see if they could get a prescription for antidepressants. So why is it important to me? Why is this study so important to me as a provider? Well, what they're saying is, are you just seeing the surface level diagnosis and the surface level concerns, or are you asking the right questions for that patient to be validated, and that validation leads to a discussion about other factors they're dealing with, in this case, depression and the prescription for antidepressants. I think it's important because I know that sometimes I've cut conversations short and later that person reveals, hey, by the way, I didn't tell you at the first visit, but I'm also dealing with X, Y, and Z. A couple times in my career that has changed my diagnosis a lot. So I don't know if that's happened to you, but let's talk about this. These authors, again, Epstein, Shields, Franks, they describe this EVC mentality, which is exploring and validating concerns, okay? Exploring and validating concerns. And they code different conversations of different doctors into, are they exploring and validating? So why is that so important? Well, validating comes up repeatedly in the research. We've got over 50 medical research articles, and validation is in a third of those, talking about how to grow trust, how to have better communication with patients, et cetera, et cetera. So validating is so important because so many people are intimidated by their healthcare professionals, by the doctors and nurses, therapists, chiropractors, physical therapists, everybody. They're intimidated. And when that doctor or provider takes time to validate their concerns and validate the fact that they're not crazy, a relationship forms. Trust is built. At that point, they will continue care. They will fulfill their treatment plan, right? Continue care, fulfill treatment plan. And they're twice as likely as to refer a friend or family member at that point. So building that early relationship is huge. All right. So how do you validate? Well, what's important is asking open-ended questions, which we've all, as providers, we've all been taught this, right? But what's also important is that you also make statements about how troubling things are. So I'll give you an example here from the study. It says, what did it feel like when your back started hurting? And then the patient said, it didn't start hurting until the next day. And instead of asking for more diagnostic information, the doctor says, back pain is pretty darn annoying, isn't it? Fantastic question. They validate the concerns. Yes, this is annoying. It's slowing down my life. It's frustrating. And when the doctor acknowledges that or validates that, it tells that patient, hey, I'm not just a robot. I'm not just looking at a disease. I'm treating you as a person, right? I'm sorry that this is happening to you. I'm sorry that it's annoying. Now, what's interesting is when doctors had low EVC scores, they didn't explore or validate their concerns, then what happened? They missed secondary diagnoses a lot. They didn't even try and test for tertiary diagnoses. They just missed the secondary diagnosis and therefore didn't offer any treatment to it, as simple as prescribing antidepressants for somebody going through depression due to their low back pain. So I always try and connect this back to our software and why we're so adamant about how great our software is. Here's one thing that can happen. It's so tough to remember to be an accurate diagnostician and a human being at the same time, right? When we fall into that technical mode, sometimes we get really robotic in our approach. So what can we do about that? Well, one trick in our software is the ability to build templates. What templates serve to do is send a message to a patient, but it reminds you to have certain aspects built in. In this case, you could build a template that starts off with, Mrs. Johnson, it was a pleasure to meet you, and I'm sorry that you're dealing with blank, right? Now, what you're doing there is you're trying to make sure that you include a validating message at the start of the conversation. Or we can include information they revealed in their initial exam, like, Mrs. Johnson, it's a pleasure to see you. I want to help make your pain not so annoying, right? I'm just saying, I know it's annoying or it's bothersome or whatever. Yes, it's validating. I want to help you with that. AKA, I'm showing empathy and we're building trust. That's what this is all about. So templates can help you do that, because I will tell you at my worst, when I'm tired, it's late in the day and I send out a message, sometimes I don't send a very warm message. It's not empathetic, right? I skip and forget things. Well, build a template that makes sure you don't skip those things. What is the problem that's bothering them? Include it at the beginning. You can have placeholders for that in our system. So every time that a message gets sent out, it feels warm and welcoming, validates that patient, and explores more concern. What happens with that? These researchers found that only 47% of doctors ask the right questions to get to those secondary diagnostic findings, right? Most of them just skip forward and we're trying to cut off the conversation. Why? We're all dealing with the clock. I mean, it's something that affects every style of healthcare now. The clock is our big enemy, and it shortens conversations that need to be extended. But with using templates and our software, again, two-way communication, we can open up that communication stream, validate that patient, and be more explorative and more validating in our responses. It's tough to do sometimes. I know, I've been there. At the end of the day, the last thing you want to do is communicate as warmly as possible. But templates can help you get around that. And when you find language that people really respond to, or people come in and they say, I can't believe you said this to me, it was a breath of fresh air, build that into your templates. Use that every time. It's okay to be a doctor and a human being and need some guidance. So if that's useful for you, check out our software, trustdrivencare.com. Hop on a webinar or check out one of our demos. We'd love to get you and all of the providers in your office started with it. You can build membership courses. You can have patients partake in surveys and forms to collect more information in a way that says, hey, your symptoms, your concerns matter to me. You could provide education based on diagnosis, do two-way text messaging, and then when it's all over, ask them for a Google review to grow your practice. And heck, ask them for a referral. If they respond positively to that Google review request, that person loves you. That's a great person to ask for a referral from. Why do you do those things? Because it allows you to have the impact that you want in your community. The right people coming into your office, feeling validated, feeling taken care of, and sending their friends to be validated, to be taken care of, will only serve to grow your office with exactly the type of patient that you want. So we want to help you get there. Check out trustdrivencare.com. Thanks.